First of all, good morning, everyone. Thank you for joining us today. My name is Charlie Sjogren-Black, and I am the Director of Operations at the International Healthcare Organization, also known as IHO.
And my name is Ahmad Elhaija. I'm an MD candidate at the UCLA School of Medicine, MBA candidate at Stanford University, and the CEO and founder of the International Healthcare Organization. Today, we're going to discuss our recent study on the homeless population in Los Angeles with a focus on Skid Row, where the homeless crisis is particularly severe. Our research aims to shed light on the complex relationships between mental health, substance abuse, and the healthcare utilization among the homeless.
So, to provide some background, Los Angeles has seen a significant increase in unsheltered homelessness, rising by over 9% from 2022 to 2023 alone. This means that over 75,000 individuals are affected in Los Angeles. This issue is particularly concentrated in Skid Row, which is a 4 square mile region housing 4,500 of LA's homeless population. Among the many challenges facing this population, mental health and substance abuse are some of the most critical issues. These challenges not only affect individuals' well-being, but also strain public health systems and resources.
Preliminary research has indicated a correlation among hospitalization, comorbidity, and mental health challenges within homeless communities. Previous research has found that homeless individuals with mental illness were more likely to use non-prescription medication and more likely to have had a more recent doctor's visit. Our study aims to explore these relationships further and understand their implications for designed interventions to enhance health outcomes for the homeless population in Los Angeles.
We conducted a cross-sectional survey through the International Healthcare Organization, assessing various community needs, including demographics, drug use, medical services, benefits, and overall needs. The surveys were administered on paper and completed independently by the respondents. Our overall sample included 163 adults from Skid Row, selected through convenience sampling. In Table 1, you can see the overall demographics of the sample before we controlled for homeless status. 12.3% of the sample was removed due to either indicating non-homeless status or refraining altogether from answering housing status before we performed further analysis. This left us with our new sample size of 143. This method, while not without its limitations, allowed us to gather a substantial amount of data in a particularly challenging environment.
Our analysis provided some telling insights. Table 2 details the distribution of responses amongst our sample. Among those identifying as homeless, 47.6% reported experiencing mental illness. Within this subgroup, a staggering 89.7% reported at least one health condition, compared to 44% among those without self-reported mental illness. This highlights a significant disparity in health conditions between those with and without mental health challenges.
Additionally, 63.2% of homeless individuals with mental illness reported using non-prescription medication in the past. This is in contrast to 46.7% of those without mental illness. Furthermore, 26.5% of homeless individuals with mental illness reported actively taking non-prescription medication, while only 14.7% of homeless individuals without mental illness reported actively taking non-prescription meds. This suggests an overall higher reliance on over-the-counter solutions among those struggling with mental health issues, which may indicate barriers to accessing appropriate medical care.
Another significant finding was a difference in healthcare utilization. Homeless individuals without mental health illness reported a longer average interval since their last physician checkup, 7 months compared to 4.1 months for those with mental illness. This indicates that those with mental health issues are more likely to seek medical attention more frequently, possibly due to more urgent and complex health needs.
These findings are crucial as they align with previous research showing that homeless individuals with mental illness tend to use healthcare facilities more often. The co-occurrence of multiple health conditions is also more common in this group, emphasizing the urgent need for interventions targeting mental health.
Primarily, current interventions for this population prioritize targeting physical health. While these interventions are also providing critical support, implementing new ones targeting causational factors of physical health issues could increase the efficacy of current programs while supporting overall improved health in Skid Row. By focusing on mental health, we can enhance the overall health outcomes for this vulnerable population. It's not just about treating one condition, but addressing the interconnected challenges that affect their overall well-being.
To more accurately target this population's needs, IHO has implemented a continuity of care program and a health net program that aims to bridge this gap by providing continuous mental health support, and thus reducing the likelihood of repeated hospitalizations and also enhancing the stability of housing transitions.
To conclude, our study highlights the critical need for targeted mental health interventions within Los Angeles's homeless population, and by prioritizing mental health care, we can make a significant impact on the well-being of thousands of individuals. This approach not only benefits the individuals, but also reduces the burden on our healthcare systems. Hundreds of millions of dollars are being funneled into helping the unhoused Skid Row residents each year, with over $280 million being spent in 2023 alone. However, the severity of this issue is outpacing intervention effort, so ensuring the efficacy of each program and efficiency of money spent is of the utmost importance. Thank you, everyone, for your time.
Thank you for your time and attention. So we're now open to questions you may have about our research and its implications.
Thank you so much. It is great to get to hear from people all over the country doing this. Looks like we have one question from Richard. What specific interventions do you recommend going forward to deliver on continuity of care goals?
Yeah, so for continuity of care, oftentimes the health providers available to the unhoused residents on Skid Row do not set up follow-up appointments because they are overwhelmed, and it's hard to have a consistent provider for many of these individuals. So one thing that's needed is definitely an expansion of healthcare services within Skid Row. Most of these individuals actually do have access to government-sponsored health insurance. So if we create more providers that they're comfortable going to consistently, then that's one way we can deliver more continuity of care.